our mental health professionals. I am a psychiatrist and a professor at the University of Bridgeport, and I came today. I do not have any personal issue with the court. I've not been adversely affected by the court personally in any way, but I have had the opportunity over the last, 6 years informally and 3 years formally to study the impact of severe personality disorders on children and co-parents and the way that the family courts around the country have dealt with that issue. And so I wanted to come and share with you some things. And I didn't know the format, so I'm going to write you up some other write-up other than what I sent you. So I'm just going to, since you're looking for recommendations, I'd like to give you some. The first part is that I've witnessed that many mental health professionals do not know how to evaluate severe personality disorders, and the problem is an extreme problem and results in children being victimized. And so my first recommendation would be that when there is an allegation that a parent has a severe personality disorder and that is connected to child abuse, that family be tracked and treated differently than the usual family court case, and that a system be set up for the proper evaluation of parents who have severe psychiatric issues and when those issues are connected to alleged abuse. I don't think from what I've seen, and that includes many hours sitting in courts as an observer, the adversarial system is not appropriate for the evaluation of severe personality disordered parents. So that's number one. And number two, I would say that connected to that recommendation is my observation that although I agree with Dr. Miller, who testified earlier that alienating behavior is common in people with psychopathy, because that is one of the things I assess in my research. I think from what I've observed, the family courts do not know how to distinguish between true psychological and physical and social abuse of children by a parent versus a protective parent trying to protect them. And so although it's good in theory to talk about alienation and good in theory to talk about protecting children from abuse, in the cases that I have followed, the courts have been unable to distinguish an alienator from a protective parent. And so that's why I think that these cases deserve some sort of special tract or treatment. So I'll just the blank. My mind just went blank. So
it absolutely does that to you, that bell. So just compose yourself and.
Okay. So the other thing I'd like to say, one last recommendation, is that in my research, I do mixed method studies, which means I collect both quantitative and qualitative data. And the qualitative data that comes from 18-year-olds and above, and sometimes older teenagers too, indicates that children are searching for answers regarding their parents' mental illness. And they are unable to get those answers because there's a gag order placed on the co-parent. And I would like to see that gag order lifted, and I am in favor of, in a sense, destigmatizing mental illness by allowing it to be talked about with the children in appropriate ways when the children bring it up. That I find that when kids come and say, you know, Mom said this thing to me that doesn't make any sense, when they say that to the co-parent is unable to give them any sort of validation that their observation of their parents' behavior is off. And so the kids end up being harmed. So I think we should treat these families in a different way, and I think in a more humane way. So
I have a two-part question.
Sure.
How many cases did you look at in your study, and then which courts?
You know, I wish I had. I promise you, I know your committee's going to be going on. I followed more than 50 cases, and I don't have the hard data for you today.
And what courts were you looking at these cases in?
Not, they've been all over the country. So I can't say specifically Connecticut, this court, that court, but I have followed from many different states.
Okay, and last part of that question, I'm sorry, is when's the last time you observed a case?
Well, within the last month. Yeah, this is ongoing research, and I find actually I get requests from people in other English-speaking countries, and the problems that were discussed today here are ubiquitous throughout the English-speaking Western world. I don't know about other places, but I do know Canada, Great Britain, the UK, New Zealand, Australia all have the same problems because people ask to participate in my research, and I turn them down.
I have a two-part question.
Sure.
First, you talk about a different track. Can you just elaborate on that a little bit for
Well,
us?
I'm not exactly sure, but I do know that the adversarial system doesn't work. So I think we need a panel of expert forensic evaluators, psychologists, possibly psychiatrists, who are paid not fee-for-service, but who are just paid a salary by the state to intervene in these cases and decide what's best for these families. And also, I didn't get a chance to say this, but I'd like the committee to understand that the families I'm talking about, the children deserve special care because their parents with severe personality disorders have a genetic reason that causes them, in part, to have these personality disorders. So these children inherit the genetic predisposition for these psychological problems from their parent, and then they're subjected to abuse and aberrant parenting, which then sends this disorder on to the next generation. So the reason why I can say that in answer to your question is I think we need a fresh approach to these families where they're not destroyed financially because they're already at risk, where they can receive an honest evaluation by honest people, and then given help tailored to the needs that they have.
And the other, you talk about severe personality disorders. Can you give us a sense
Well,
of
cluster B has already been said here, so I'll say that.
For the general public who might not be understanding what that is.
These are people, well, I can talk about it in terms of traits. These are, parenting is an activity, just like intelligence that is referenced to the brain. Well, there's a parenting pathway in the brain, and people with severe personality disorders that have traits of poor impulse control, lack of empathy, callousness, egocentrism, irresponsibility, those are the traits that I'm talking about that sum together. And those things alone wouldn't be an issue, but they are frequently accompanied by abuse of loved ones.
Thank you very much. Dr. Horwitz?
I'm very intrigued with your thought about a special track for people with severe personality disorders. My guess is that most of the child custody matters that actually go to trial could probably be viewed, at least by half of the people looking at those cases, as involving personality disorders. I'm wondering how would you foresee doing this assessment, and how early in the case, and how would it be different from the evaluations that typically already are being done?
Well, what I can say based on the cases that I've followed, first of all, as a psychiatrist, and as a researcher, when I do an evaluation, I take in all information that I can possibly get, and then I weigh it. Now, and so one of the things that I've observed in various cases, and granted not all in Connecticut, what I've observed is that evaluators and the judges are restricted from getting information. Well, that does not facilitate a psychological evaluation. I think that evaluators have to have all possible information on both parents, their complete history, how they've functioned, And so, for example, the cases that I'm talking about, when I got all the information, it was not ambiguous. The people in my study, the parents have criminal records. There's publicly available information that identifies them. There are multiple. The other thing that I've found is knowing these cases and then watching them in the courts. I have witnessed myself perjury on the part of severely personality disordered parents, and it's never prosecuted. And so I think that's another problem that should be dealt with. If you prosecuted severely personality disordered parents for committing perjury, you'd be in a different arena, because that would, put a stop to their activity. So I think being able to get accurate information and to be able to identify the falsehoods and manipulations of severely personality disordered parents, that would be helpful. I hope that answered what you said. And so how would we find a committee? I think we'd have to have volunteers, and possibly no one would volunteer for the job. But I do think we have to take the financial motive out of it.
And as far as the 3 areas that we're charged with making recommendations about, I take it you're very much against the presumption of shared custody.
Well, see, what I think would be a good compromise, I'm actually for shared custody.
Oh.
The thing for people who are psychologically normal. And since you brought it up, I'd like to point out as a scientist that correlation does not equate to causation. And so the reason, possibly one hypothesis for the reason why children under shared parenting do better, is that these are 2 relatively psychologically healthy parents that can share parenting, and that also they have relatively good genes, and they're passing them on to their children. To me, that's a different situation than psychologically ill people, if you want to put it that way, and their genetics being passed on to their parents. So I feel like I veered off. I apologize.
Well, no, I just was I was
Oh,
reading
what
your
about-
testimony, and you said that you're.
So what about the shared parenting? So the thing
You're
that
opposed
scares
to
me there is the word presumption. Because I have heard, and I myself have had conversations with GALs, and there is a misguided assumption that every child is better off with a relationship with both parents. It's extremely misguided. That often the children of the families that I am watching would be better off if they had minimal contact with their personality disordered parent, because that person their approach to relationships is one of abuse. And so the child can't have contact with that individual without being abused. It's just impossible. And so somehow we need professionals to acknowledge and protect these children, because these are the children that are at genetic risk to develop these same disorders that their parents have, or internalizing disorders like anxiety and depression, PTSD from being subjected to the abuse of the controlling, or however you want to put it, disordered parent.
This is a little off track, but I have a question for you.
Yes,
So if, say it was an intact family, and one of the parents has a severe personality disorder, or isn't, as you say, psychologically normal, would you suggest that child be removed from that home?
Actually, so I can tell you that because because of what I do, I have members of the public talk to me. And I frequently encourage people to stay together and not separate. Because, unless there's severe physical abuse of the co-parent. And so, because I think that it's better for the children, if they're going to have a relationship with the disordered parent, to have it with the healthy parent around than to be put alone with the disordered parent. I think that's the issue, is children going alone with the disordered parent. And I find that in the cases that I follow, that the minute there is, even though the co-parent may have overwhelming evidence that this person is abusive and damaging and a criminal or whatever else, that the disordered parents give an unsupervised visitation, and that's very damaging to the children. So, I can't make decisions for everyone, but I think it's better for parents to stay together in this situation at times.
Dr. Thayer.
I just wanted to speak to the second thing you talked about, which is talking about mental illness to children and removing what you said is the gag order. Sometimes parents don't have to be, as you're labeling them, mentally disabled in any way. They may just be angry. They may just be frightened. They may just be uneducated. And so if we're going to talk to children about mental illness, wouldn't you think that it should be done in a way that maybe in a therapeutic setting or with education of the parents or some role playing of or practicing of what should be said to the children, rather than just removing that and allowing parents who might be very scared about not having their children say things that could be damaging to them about the other parent?
Right. And so, like I said, I wanted to really differentiate the cases that I'm concerned about, which are cases where there's a severely personality disordered parent, from the usual case. And so I agree with you fully that the gag order is good for most families, but it's not good for the families where children are desperately seeking meaning in their experiences. And when I send you what I have, I'll send you the papers that I've written about children seeking meaning and trying to understand what they've experienced. And we see the same thing with children of people with schizophrenia, that they're trying to understand why mom is hallucinating, what is dad saying, he thinks the house is bugged. And I don't know if those parents are under a gag order, but I would say that it's reasonable when children want to talk about that with the relatively healthy parent, that the healthy parent's able to help them. And of course, I do agree that mental health therapists for the children in these circumstances is a good thing, and I would encourage
Thank you.
it.
Thank you very much. I'm asked if we can just kind of get an idea of who is still here.